Let us discuss some very important images in pediatrics for your quick revision. What is this device? So this is a infantometer, okay, infantometer. So infantometer is, as you can see, it is a horizontal ruler like thing and two vertical boards are there. So you make the baby lie down on this and you measure the length of the baby using this, okay. What is this? So this you can see is a measuring tape which has got a red zone, a yellow zone and a green zone. And this is used to measure the mid-arm circumference, okay. It is used to measure the mid-arm circumference of a child. So what is the name of this device which is used to measure the mid-arm circumference and has got the red, yellow and green zones? So this is the Shakir's tape, okay. What is this? So this is a simple device where you have a string on which different ovoid bodies of different sizes are there and a number is written on each of them. So this device is basically known as a Kaido Meter, okay, Kaido Meter, and it is used to assess testicular size. So what you do is you stretch the scrotal skin and compare that the testicular size of the child is corresponding to which ovoid body. Suppose it is corresponding with this, then the testicular size is 10 ml, okay. What is this? So this is another device which is, can you see what is this device measuring? So it is used to measure the skin fold thickness, okay. So what is the device used to measure the skin fold thickness? It is known as Harpenden calipers. So Harpenden calipers are used to measure the skin fold thickness, right. What is the diagnosis here? So can we touch both of our shoulders with each other anteriorly? We cannot touch them with each other, but this child can do that because he has absent clavicles. So absent clavicles are present in a condition, are seen in a condition that is known as cleidocranial dysostosis. Cleidocranial dysostosis. So this is a condition where the clavicles are completely or partly absent, okay. So you have absent clavicles. As a result, the child can touch both of his shoulders with each other anteriorly. In these individuals, you get a large anterior fontanelle, okay, during infancy. And apart from that, they also have delayed dentition, okay. What do you mean by delayed dentition? That means we call it delayed dentition when no teeth appears by the age of 13 months. Then it is called delayed dentition, okay. So delayed dentition. And supernumerary teeth is also seen. Supernumerary teeth means teeth more than the usual number. Okay, supernumerary teeth.